most dangerous phobia in the world is also the most common phobia in the world, yet it's the one we talk about the least. Often called white coat fever, it's that phobia of blood and needles that often ends in somebody fainting. And if you have it, don't worry, so do I. So I'm going to avoid talking about any of the major triggers in this video. What makes this phobia dangerous is that it prevents people from seeking medical attention or preventative medicine when they need it. And beyond the humiliation of passing out, fainting is not a pleasant experience. In the movies, it might look like more of a peaceful swoon, but in real life, it's more like a small seizure, and it'll knock you out for the rest of the day. And I should know, I have passed out more times than I can remember, and not just in the doctor's office. I was the kid in kindergarten class that passed out when we were talking about mosquitoes. Biology in high school and college was a particular nightmare. The bad news is, if you're like me, this is part of your DNA. It's not going anywhere, and you likely inherited it from somebody as a genetic trait. The good news is, you can manage it. My own health aside, I didn't like the fact that I couldn't support my kids whenever they were in a doctor's office or a hospital room. So I found a behavioral therapist at UMMC who told me that she could help. And despite this being the most common phobia on the planet, she said that in her 17 years of practicing medicine, I was the first one to approach her. Managing the phobia and my body's response to it came down to three things. 1, understanding what it is. 2, retraining my brain to not see things as threats that weren't really threats. And 3, to learn to forgive myself in the times that I couldn't. First, what causes it? The medical term is a vasovagal response, and it means that in high-stress situations, the moment that our adrenaline starts to taper off, our blood pressure plummets and we faint. Most people, the blood pressure in the body's stress response, it gradually goes up and gradually goes down, but not us. We plummet straight off a cliff. As crazy as it sounds, back in the hunter-gatherer days, this would have been considered a strength and not a weakness. It comes from a heightened fight or flight response, and it would have helped us to hide from threats by disguising our pulse and our breathing, or to stay alive longer if we were wounded or injured. The problem is, things aren't trying to kill us on a daily basis now, but our bodies are still wired as if they were. That means that fight or flight response is now being applied to more modern stressors like paying bills and healthcare. Which brings us to part 2, retraining our brains. The first time that you ever fainted, whether it was in a doctor's office or a classroom, that reinforced in your brain that there was indeed a threat, and that your body's response to that threat by fainting was successful in you surviving. This essentially creates almost like a habit in your brain, so it's much more likely to happen the next time. So the next time you do go into a doctor's office, your body's fight or flight response is going to kick in with the sweats, the quickened pulse, the fidgeting, and just that urgent desire to get out of there as quickly as possible. Some people try to escape this by just avoiding the situation or avoiding certain topics altogether, but this also convinces your brain that you have successfully navigated around a threat by creating something in your head called an avoidance. So the only way to really manage this phobia is to address it head on. And that's why at UMMC, I went through a 6-month program called exposure therapy, which is basically a system that helps you hijack that fight or flight response in your brain before you can reach that critical level. Every day of that program, I would force myself to face just a little bit more fear. I might have been watching a YouTube video, having my blood pressure taken, wearing one of those little blue armbands they give you, basically pushing myself each time to a point of discomfort where I felt like I just couldn't go any further, and then holding myself there until my brain finally started to acknowledge that this wasn't going to kill me. And then the next day, I'd try to push a little further beyond that. If that sounds miserable, it is. It was very miserable. But gradually, my brain began to let go of this idea that certain things were a threat, specifically at the doctor's office. And as my brain let go, my body stopped responding to that fear as well. Now, I still do struggle in the doctor's offices, as any nurse in the metro area can probably attest, but I still show up for the appointments. But I can also watch movies that I couldn't watch before. I don't have to excuse myself from conversations that were uncomfortable. And I can go with my kids when they have to go to the doctor. I call that a victory. And the final part of the puzzle was just letting go of this idea that I had of fainting. Knowing that this was a genetic thing and not a weakness of mine made it a little less embarrassing. And it made it more likely that I could talk to doctors and nurses ahead of my visits so that if something did happen, they were prepared and we were able to discuss it as if it were something normal, which made it a lot less stressful. And pro tip, They see this all the time. There's nothing to be ashamed of, and they really do appreciate the heads up. I also learned some tricks like applied muscle tension, which is a way of preventing your body from relaxing too quickly. But mostly I learned this mantra: fainting isn't failure. It's just a physical response that we have to live with, like allergies or getting goosebumps. The only failure is when we allow fear to prevent us from asking for the help that we need. If this is something you'd like to know more about, please let me know in the comments and I'll do a part 2. I also self-published a book on my experiences. It's not great, but it'll at least point you in the right direction. But until then, as cliche as it sounds, good luck out there, and the only thing to fear is fear itself.